All right, it is 1:01 p.m. and we will get started today on November 2nd, 2020. This is a regular meeting of the Lake County Board of County Commissioners. And I believe that we are all in attendance today. So today on our agenda, I'll put it in the chat, we have a few items. We have the Lake County Public Health Department update and mitigation plan discussion, CARES Act funding allocation discussion, electronic health records decision, agreement for services between the Board of County Commissioners and Left Hand Management, LLC, mineral belt trail grooming, landmark environmental, additional disposal cost for environmental testing, and the renewal of Safeway Store 46 Incorporated fermented malt liquor license. And I'll put this in the chat. All right, and so with that, we will go ahead and move into an approval of the agenda. So,
Commissioner Marcella, this is Sarah Mudge. I am wondering, I'm not familiar with all the items on the agenda.
okay. Which one in particular?
I'm sorry, I'm trying to pull it up. The left-hand management.
Okay.
Is Patty on?
She is. Let me try to unmute her real quick here. Patty, can you unmute for us?
Okay, yes, I have this. This came to me from Janine.
Okay.
And I believe we've done this in the past, the same contract. I think this might just be a renewal.
Okay, it's for behavioral health services through Department of Human Services?
Yes.
Okay. Thank you, Patty. I appreciate it.
You're welcome.
All right. Commissioner Mudge, does that answer your question?
Yeah, that's fine. And then the landmark environmental additional disposal costs.
Yeah, so they're doing the geotechnical testing on the two proposed sites for Justice Center due diligence, and there is an additional cost for the disposal of materials for that environmental testing. And Chris can speak to that.
Okay, so this is probably a conversation about the repository and or incurring those additional costs.
Yes.
Okay. Very good.
All right.
Thank you.
Yep. Commissioner Glenn or Commissioner Mudge, are there any further questions on the agenda at this time?
No, I don't think so. Thank you.
Commissioner Glenn, do you have? No? Okay. Can I entertain a motion for an approval of the agenda?
So moved.
All right. Second. Any further discussion, Commissioner Glenn?
No.
Commissioner Mudge?
Nope.
All right. Seeing none, all those in favor? Aye.
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 All right. Thank you both very much. All right. So with that, we will move into community informational items. Commissioner Mudge, do you have any community informational items today?
I don't have much new. Just don't forget to cast your vote by tomorrow, end of day. And other than that, wrapping, some of the physical projects up and having conversations and continuing kind of the development of, I know Commissioner Marcel is also included in those with the state and trying to kind of anticipate a spike or another surge or a different response in seeing what the trends we're seeing for COVID. But it seems that those conversations are happening pretty frequently. And I have hopes that the state's going to be able to respond with something that delineates kind of that urban treatment of response from a rural one. So I appreciate all the conversation that's been had thus far between the partners, Commissioner Marcella and Colleen, and look forward to seeing where that goes.
Cool. Thank you. Commissioner Glenn, do you have any community informational items to share today?
I do not.
All right. The only thing I'd like to share at this point is just a couple things. Our website is live if you have not seen it. Be sure to check it out.
Yeah.
There are a ton of resources on that new website and links to COVID information. I'd like to give a huge shout out to Public Health and Office of Emergency Management and our PIO for working so hard the past week or so to put together some preliminary mitigation measures and having those conversations. Thank you for doing that. I would also like to take a minute just to thank the rec department for Trunk or Treat. I feel like that event was really wonderful and really needed and went very well. So thank you for the effort and the time that they had put in to hosting that event for our community this weekend. Very much appreciated. And so with that, we will move into commissioner clarifications. Commissioner Glenn, do you have any clarifications at this point?
I do not.
Commissioner Mudge?
I have no clarifications. Thank you.
All right, thanks. At this point, we'll move into public comment on items not on the agenda. If you would like to make a public comment on an item not on the agenda today, please raise your hand and I will call on you. You will have 3 minutes to give us your public comment. Okay, I don't see anything at this point for public comments. If you'd like to unmute yourself for public comment, you're welcome to do that as well. Okay. All right, seeing none, we will move on to the first item on our agenda, which is an LCPHA, Lake County Public Health update and mitigation plan discussion. So with that, I'm going to turn it over to our Director of Public Health, Colleen Nielsen, and we also have Kaylee Ham and Josh Adamson from the Office of Emergency Management with us as well. So I'll hand it over to you, Colleen.
Thanks, Kayla. And before I get started, I too would like to thank Lake County Rec Department, Amber and her crew, for a successful event. I was able to take my child through and I felt that it was really well done. So thank you so much for bringing that to our community. So really appreciate that. As far as an update, we're kind of in that trending kind of to what you both you and Commissioner Mudge had spoken to in the sense of, we continue to see increases in cases, not only here in our county, but across the state. We did put a mitigation plan together that was submitted to the state last week. As we know, a plan like that is something that continues to evolve as situations arise. And the big push, as you know, has been communication with our community, trying to get folks to recommit to, those levels of containment and, the usual wash your hands, wear a face covering, 6 feet physical distancing and staying away from things when you're sick. And so those are some of the big pushes that we're seeing, more on the personal level. We are working with our businesses as well to see if there's any room for concessions that will allow us to remain in yellow, but maybe have some other parameters in place, like a curfew, if you will, to decrease the amount of time people have to gather out in a social setting. Nothing is set yet. We are meeting with businesses on Wednesday at 5 to have that discussion. We do anticipate amending our public health order once we have those conversations in the next couple of days, and then submitting that to the state, showing them that even though we are in, safer at home level 2, which is yellow, we might have some other restrictions that might allow us to remain in that level. And kind of to both of your points in the sense of, not necessarily one size fits all, but it takes all of us doing our part, all of our community members, and to go from there. So that is kind of where we're at. Like I said, I'll be updating the state throughout the week with, all of the conversations that we're having, just to, once again, show that unified front, that we all understand, what is happening in our community. The ability to kind of reach people locally is kind of where we're at. So I think that's all I have to say, and I'll take any questions on that.
All right, thank you, Colleen. Is there anybody that has any questions for Colleen at this point before the board may have any questions? No? Okay. Colleen, I just had a quick question about our cases and our positivity percentage over the weekend or in the past week. Could you just remind us of where we're at with that?
Yeah, so we actually don't tease out the information weekly, Kayla. So we do it on a 2-week basis in order to be, in alignment with the state. And if we were to look at how the state is currently tracking us, it shows that our positivity rate between 10/18 to 10/31 was at 8.41%. So that is in yellow at this point in time. So safer, level 2 concern. We know that over the weekend, we had, as of yesterday, we had 8 cases be reported to us yesterday, obviously following up with those folks now. And part of our discussion is that we recognize that if we get 8 cases in one day, that could very easily put us past that 10% window, which is the, level 3, which is 10 to 15% positivity rate. So that is what the state has. Our numbers will be a little different because the way the state does it, it's on a rolling basis. So when I look at this tomorrow, it'll be, 10/19 through November 1st. And so, we'll see those cases hit tomorrow into the state and see where our positivity rate is, if that makes sense.
Yeah, that makes sense. Are antibody tests still being counted towards the positive tests?
They are not. So we have not counted antibodies in our positive rate since, I want to say June. I have to look. I think it's like June 9th. Is our cutoff, or maybe it's July 9th. If anyone knows, they can jump in. But those cases aren't counted in the state cases at all. They didn't track those as positives, if that makes sense. So sometimes, like, you recognize that our numbers and the state numbers are a little off.
Okay, that makes sense. Can you still get an antibody test, and what is the, what's the conclusiveness of that test, if it's still available or not available?
Yeah, so that test is still available both at St. Vincent Hospital as well as Rocky Mountain Family Practice. There are some insurance companies that do pay for it, but there are other insurance companies that do not pay for it. And so if you're symptomatic, obviously you wouldn't get an antibody test, you would get an active test instead. But what basically, what we were trying to do initially with the antibody test was just trying to see how many folks have actually been infected in our community. We still know that there's a high rate of folks that don't come down with symptoms, but still have the ability to pass on the disease. So it was just a tool, like another tool in the toolbox to kind of measure how many folks, in our county, have had COVID-19. And so that is how we had used it in the past. And so I think some testing has dropped off as folks, as we have moved through this and people are seeing kind of what's happening, in the sense of, hey, this is what you need to do to protect yourselves, your family, and if you were to be sick, to get tested.
Okay, that makes sense. Thanks, Colleen. Commissioner Glenn or Commissioner Mudge, do either of you have any questions for Colleen at this point?
I don't have any.
Okay.
I don't have any questions, Commissioner Marcella. I just want to reiterate, I know, there's been a lot of angst over whether or not the community will move in or out of the stage that we're currently in. And there's been a lot of, concern over that community behavior. And as best I can continue to encourage us as county staff and public servants to do our part to set the example. and lead by example to continue to wear our masks, especially with the election happening and folks coming in and out of the courthouse in higher numbers than usual over the next couple of days. You know, we're fighting for the livelihood of our downtown business owners, and we certainly don't need to add to their stress and or just a community problem, potential problem and exposure by not doing our best to follow best practices and protocols with social distancing and mask wearing. So I just want to remind and thank those who are wearing their masks and being very diligent about it, and remind our colleagues that if you are not, you are not, you know, you are you are contributing to kind of the public an economic strain, if you will, of an unknown and what could possibly happen and push us over the threshold. So as best we can as county employees, let's do our part and push and remind others, even with outside the organization, of course, to do what's best for the community as a whole.
Thanks, Sarah. Colleen, could you just address for us quickly, if you've tested positive for COVID, does that eliminate the need to wear a face covering?
It does not eliminate the need. So we do know that people who have had COVID before can get it again. So it's important that you continue to wear your masks. And I think that's, you know, another piece of the puzzle, no matter which way we move, you know, up the dial or down the dial. It's still important to, you know, wear a mask, face covering, you know, in public, as well as all the other measures. But no, just because you had it does not mean that you are free and in the clear. We have no idea what immunity looks like. We also know that people can get reinfected. So please wear your mask.
Right, and people aren't always symptomatic. And so because you don't have signs of carrying the virus, that doesn't mean that you aren't carrying it and can't spread it.
That is correct. Thank you, Sarah.
Thank you. All right, does anybody have any further questions for Colleen about this mitigation plan or update to us on our current COVID pandemic response? No? All right. Well, thank you very much, Colleen. We sure appreciate your time.
Yeah, thank you, Colleen, and thank you for the continued conversation with CDPHE and the state.
Absolutely. Thank you, guys.
All right, so we will move into number 2, which is CARES Act funding allocation discussion. So we heard from CCI over the last week that there is kind of a push for us to complete the allocation of our CARES funding. And so on the county level, we've got some funding left that I think we need to take a look at and make a decision on, or a rough decision on. So with that being said, Commissioner Mudge and Commissioner Glenn, do you have any anything to put out there for CARES Act funding allocation that we'd need to look into reaching out to organizations for, or anything like that? I have on my list a reimbursement to Build a Generation for the Unmet Needs Committee, school district support for early intervention, and potentially additional support for second day programming funding. Let's see here. Thank you, Commissioner Mudge. Main Street Ambassadors, Advocates of Lake County. Okay. Wonderful.
Sorry, I was muted. No, I think you've touched on a couple of new requests that would certainly be appropriate, I think. we have broadband expansion, we have, continued website development, whoops. And communications that needs improvement on, though I'm not sure we know exactly what that looks like now, but I think some of these things we can allocate to the EDC, reimbursing BAG for unmet needs expenses, have potential new or an additional allocation to the unmet needs committee by the end of the year, depending on what some of these other items, what the cost on some of those look like.
Commissioner Glenn, do you have any questions or comments or anything like that on CARES Act funding, or anything you'd like to see that funding dedicated to?
Well, I haven't heard any discussion about the businesses in town and how CARES funding could help impact their situation. That's my main.
Thanks, Commissioner Glenn. I did have that earmarked on my notes to set aside some money for the EDC for direct business support. I see that highlighted on your spreadsheet there, Sarah, too.
Yeah, I think we were gonna wait to hear a bit more from Marla, perhaps the EDC director. I don't know whether or not that amount that I have in there just preliminarily even covers what she had thought, and whether that was actual, some physical elements of.
Oh, sounded like you cut out. Yeah, Commissioner Glenn, I know that in my conversations with Marla at the EDC, she's been really instrumental in working with the business community to get a list of needs and potential requests going into the winter season. So I think once she has that data collected, then she would be able to assist us with what that looks like for the winter months. But I think it would be better to drive that through the Economic Development Corporation. And they might be able to line that up with similar supports or a similar structure to the city's grant program that they did in the beginning of the pandemic, if that makes sense.
Commissioner Marcella, this is Janine McGee.
Yes.
Can you hear me?
Hi. Yes, I can.
Hi. So I know you all had asked me to look into some options, and it sounds like you've talked to the school district some. When I did have a small meeting last week with some of the folks who are providing the second day support, some of the agencies, Get Outdoors, Leadville, and Full Circle. They did suggest that if there could be some CARES Act funding used to pay for some of those supports in the state year, or actually in this calendar year, then that would ensure that they have the ability to put those funds in the spring towards those supports. So that was one. And then also, there is the potential that we could come up with some Friday activities that would be neighborhood based, and it would be a modification of existing plans that were set up for Friday activities, and it would just be some modified versions of that, following, of course, public health orders and being outdoors. So if there is some funding available, there's some potential that there might be some Friday activities that could be done in a neighborhood base. And the challenge would be, of course, just identifying staff who could do that. But there is, I think, some potential for looking into that, at least through maybe the time that school's out through the end of the year, so that families have something to get outdoors. But anyway, that is the results of what you asked me to look into to some degree. So it sounds like you've had some conversations about second day supports, and I'd be happy to provide you with any more detail if you need that.
Yeah, thanks, Janine. Do you know, it sounds like there is still a need for that Friday programming, correct? And after school programming?
There is not any programming going on right now. And the challenge right now is that all of the staff that would be doing that programming is providing second day support programming for the school district. So
Okay.
there could be potential to do some Friday programming if we could identify some staff who could do it. And there is already some programming ideas lined up, and those could be modified for, wintertime, taking a group of kids out, going snowshoeing, having some warming heaters and hot cocoa, that kind of thing, where the goal could be to still continue to provide mental health and well-being for families, knowing that when kids are active and they're able to get out of the house for a little while, that's a benefit to the whole household. So we don't have any specific plans lined up, but we could put something potentially in place if you wanted some of the CARES funding to be dedicated to that, at least through the end of the year.
Okay. Yeah, I think, go ahead.
No, sorry, Kayla, I didn't mean to interrupt. Go ahead, finish your thought.
No, I just think that will be necessary, because I think it will provide an opportunity for some of that academic intervention and assistance with some of the time lost in the classroom. And I think that will be critical for our students and families.
I want to apologize for getting kicked off of the internet there for a minute, but Janine, I missed the beginning of what you were saying. I also want to remind folks that the library, has been continuing to develop programming, and been talking to Brenna about how that doesn't necessarily fill in with kind of direct demands or requests from the school, but I just want us all to kind of be aware and continue to promote everything that's offered and is being developed to be offered through the library. I think that can be a great. Those programs will also be great in filling time and getting kids out or in keeping them engaged.
Mm-hmm. Definitely. Okay. Okay, so it sounds like we have a little bit more work to do on that. I will reach back out to Bethany at the school district and see how that would work for us to potentially fund them or give them some assistance. And reach back out to Marla at the EDC as well and collect that information.
Okay.
And then let's
I can work to verify with Amber, who's been doing our PPE ordering, how much we have ordered and in stock, and if we want to submit another order. We did order the backpack, so we have that for reimbursement. I am happy to make a couple of motions if we think we're ready to do the bag reimbursement and allocate some funding to the advocates so we can get that rolling.
Sure. Commissioner Glenn, do you feel comfortable with making those commitments today? Or I guess I will entertain a motion and we can discuss that.
Yeah, I was just, forgive me, I was just looking for the specific number, which I will. I know Katie Baldessar had given us that. Sorry, I'm having trouble finding it right now.
I can pull that up probably. So the build a generation request to us
The
is
reimbursement.
$33,575 for payments that have already been provided to community members through the Unmet Needs Committee.
33,575.
Yes.
Okay. Okay. I'll move that we reimburse Lake County Builder Generation for their early COVID contributions to the Unmet Needs Committee in the amount of $33,575.
Okay. I will second.
With CARES
Commissioner,
funding, I guess I should add.
thanks. Commissioner Glenn, do you have any further discussion?
I do not.
All right. Commissioner Mudge?
No,
Okay.
thank you.
All right. All those in favor? Aye.
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 Okay. So I will let Builder Generation know that we will get that out to them.
Just a reminder too, this is Janine McGee again, that any business owners who are struggling financially can apply for the Unmet Needs Committee funding for their personal mortgage rental expenses. If they're, if those financial hardships are related to COVID and that's impacted their business, they are certainly eligible. So that's
Right.
another way that we are supporting the business community by supporting through the rental and mortgage assistance program.
Okay. Thanks, Janine.
Yeah, thanks, Janine. And not to forget the SBDC and the EDC are there to offer assistance in state and any federal funding that may still be available or other resources.
Janine, I see that you're on your phone, and Marla from the EDC has just written into the chat if you can send information to Marla to get out to the business community regarding the Unmet Needs Committee and who can apply for that.
Yeah, it's really, I will do that. It's eligible to anybody who's been impacted by COVID, and it can cover rent or mortgage or utilities based on where the funding source is coming from. But Full Circle is the agency that's taking the applications,
Okay.
and they have an application referral form. So I'll get that to you, Marla.
Thanks, Janine. Marla, we were just talking about the business community needs and the need for a potential grant cycle in the wintertime, and wondering if you had an opportunity to connect with any of that or compile any data through any of the business interviews that you've been conducting.
Sorry, I jumped on here late. The answer is we are compiling some information presently and pushing out a survey, but also face-to-face visits. We are trying to be very strategic and tactical because some of the businesses did have a great summer. So it's determining the ones that would have issues during the winter months. So I don't have a direct answer for you right now, but we're hoping to have something by the end of this week.
Okay, thank you very much. I do appreciate that. And you would be able to give us like a ballpark of what a potential grant funding structure similar to what the city had done would look like based on that data that you're compiling?
That's correct. We have
Okay.
tried to reallocate or rethink the questions due to the summer impact that some businesses had and has done great. And then just making sure that the money, if the money would be appropriated, that it goes to the right people.
Okay, great.
Marla,
Thanks so much, Marla. Oh, go ahead,
This
Commissioner
is
Mudge.
Sarah Mudge. Marla, I'm also wondering, I think at some point there was talk in the work done in conjunction with the Main Street Committee that there were some other, physical items or elements that could be purchased to assist downtown businesses as well. Will we have maybe a short list of those as, like heaters or any other items?
That's a good question, Commissioner Mudge, because the reason I was trying to get on here earlier, the state is looking at grants specifically for restaurants, and I was on that Zoom meeting a minute ago regarding heaters, igloos, tents, and then they also are trying to figure out the safety side of that. So there is a grant opportunity specifically for restaurants during this unusual time, and I'll make sure that you get a copy of that once they push it out here this afternoon.
Thanks, Marla. Would restaurants be responsible for applying for that on their own?
I haven't looked at the application yet, but
Okay.
I'm making that assumption that that is the case.
Okay. That sounds good. We might need to think about how we can lend some additional support for filling out those grant applications and what that means for those businesses, because I think that can be kind of a scary and overwhelming task if you haven't done that before.
Very true.
Yeah, and so I think we'd want to make sure we think about assistance for that. But if you'll forward that on when you get that, that'd be great. I'd appreciate that.
Yes.
Okay, so for that, then let's earmark that EDC and business support until we hear from Marla once she's finished compiling her data. It sounds like that's in the works, and then once she gets that done, then we'll be able to make a decision on that.
That sounds good. Yeah, it sounds like there's a few line items that we'll have a lot more information on in the next week or so.
Okay, cool. Commissioner Glenn, do you have anything else to add at this point for CARES Act funding, or any suggestions or anything you'd like to see that funding allocated towards?
I do not.
Okay. Commissioner Mudge?
I did want to just address the advocates request and make a motion to make a donation of $25,000, or I'm sorry, allocate $25,000 of that CARES funding to the advocates of Lake County due to their significant decrease, and we know in funding, and we know that the demand is only increasing.
I will second that. Commissioner Glenn, do you have any further discussion on that?
I do not.
Okay. Commissioner Mudge, do you have any further discussion on that?
I don't think I do. No, I'm not at this time.
Okay. I don't have any either. So seeing none, all those in favor? Aye.
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 All right. I don't think that at this time I have anything further for CARES Act funding. Commissioner Glenn or Commissioner Mudge, do you have anything further? I think I need to work through those numbers a little more and then connect with Marla, and then we can have a work session about this next Tuesday, if that works for everyone.
That'd be great.
Okay.
Thank you.
Commissioner Glenn, does that sound like a good plan?
Sure.
All right. Sounds good. Thanks. All right, so we will move on to agenda item number 3, which comes to us from Lake County Public Health, electronic health records. So I'm going to hand it over to Colleen.
Yeah, thank you so much. So speaking of CARES funding, from the beginning, there's been, just a space holder for public health in the amount of $100,000. And I had shared there's not much in the scheme of it all that we could really accomplish with that. Like, one of the conversations was, hey, let's get a mobile unit. We looked into that, and it just wasn't feasible for the timeline and for what we really needed when we really looked at that mobile piece to actually get, the bells and whistles to actually make sense for us. It would push us, closer to $200,000. So we were having other conversations about, what would be a really good use of, the county's CARES funding for public health specifically. And an electronic health record is something that, my staff, we've communicated about, talked about, and recognized that this would be an amazing tool to have. There are very few public health agencies currently operating without operating with an electronic health record. And the reason why we think this is important in the day of COVID is when the opportunity for vaccines for COVID-19 come, we are going to do what we call appointed dispensing. We're going to be practicing that this Saturday. We're going to do a free flu clinic on Saturday the 7th. So there's opportunity there for us to practice. The reality is that we have to input all of that information into our state system for whether it's flu, whether it's other vaccines. This electronic health record has the ability to talk to the state database, not only in immunizations, but in family planning and some of our disease reporting as well. And so when we think about our time and efficiency about everything that we're doing, so much of what we end up doing is double, if not sometimes triple entry. And bringing it back to the COVID-19 part is we know that with the COVID-19 vaccine, it is going to be a 2-shot series, and it has to be the same vaccine, because right now we know there's multiple vaccines that are being developed, and we don't know what that presentation looks like coming to us yet. But whatever it is, we have to repeat that dose 28 days or greater. By having an electronic health record, we have the ability to not only know the vaccine, but to actually have messaging go out to everyone who's received that COVID-19 vaccine in order to make sure that they come back in for their second dose. Otherwise, it's not a very successful vaccination campaign if folks don't finish that series. And so I had sent to the county commissioners kind of the proposal. It's from Patagonia Health specifically. We've looked at some other records, but this is one that's operating currently in Colorado, has access to talk to state databases. And we know the biggest person who's using it, or biggest entity that's using it right now, is El Paso County with great success. I believe on page, you guys have it up, or I can share it depending on where you're at.
Colleen, could you share your screen?
Yeah, absolutely. I would love to.
That'd be great.
Yeah. But I had sent that to you guys last week with all of the updated numbers. And so I can scroll through, but basically this is kind of where we're at as far as the sales agreement is. Total for 5 years is $117,525.04. The first year is always the most expensive. As you can imagine, it's the setup, it's the integration of data and making sure that we have everything going, if you will. And then from there, it's kind of a monthly subscription. And so that works out to be about $1,200 a month. When we think about all our programs that would be utilizing this, we have the ability to pick up that cost monthly. It's kind of that initial first year. Patagonia is willing to work with us in the sense of the more we put up front initially, the less our monthly payments are for the next 5 years. And so that is kind of the question on the table is, we think this is going to be a great tool. We think, we have the opportunity now prior to the vaccine to become familiar with this electronic health record and have the ability once we have the vaccine to input one time very quickly, as well as populate the system in order to send out reminders to everyone. We have the ability to do that in the form of, phone calls, kind of that automated phone call, as well as, text messaging, depending on what people's preferences are. And obviously that's just the COVID piece. You can imagine across the board in all of our programming in public health, this would be, a valuable asset to have. It's a great opportunity to invest in electronic health record while there is some funding, because there hasn't been funding that would support this. In the past, there's been a little bit of funding, but not enough to actually get something rolling, especially, where we are in for our needs. So basically what I have is a sales agreement on the table. And the ask is, obviously you set aside $100,000 for public health. We haven't utilized any of the CARES Act funding. It would be a matter of where the county is comfortable in supporting, up to a certain amount. And then we can have Patagonia Health rewrite this contract in whatever we think that initial payment would be, from CARES funding, and then work out, the rest of the details to equal that total for 5 years, if that makes sense. And if you want, I can show you some of the features if that's helpful, but it's really up to you and questions that you have.
Colleen, I'm wondering more so on, if this, we certainly have invested in other software for efficiencies across other departments. And it does, make sense. I mean, our population compared to El Paso and Colorado Springs area is clearly very different. But I'm wondering what, where else will you be able to reallocate staff time in creating some of these efficiencies? Can more of your staff shift to helping even more with the response? And another question on, you were touching on it as I was wondering, there are the other features of that outreach piece. You were talking about, you know, people who've gotten the vaccine who would be in the system, then you can send reminders or texts or whatnot. Is this something that could be used a little more broadly than that, even? As far as the communications and reaching out to folks?
Well, so it's right. So the first piece is, I think, you know, as far as being able to ship folks, I think that'll actually make people at this point in time not feel, you know, always a couple of days behind, if you will. And the fact that, hey, it's a one-time entry. The way it would work as far as messaging, people would actually have to be, you know, clients of public health. This isn't just a general like, hey, register for this message service, if you will. I think that's, you know, more utilized through, you know, what Kaylee Ham has available in her alerts and things like that. And so it'd really be folks who are utilizing public health in all of their services. And so I just threw out El Paso only because we work with them regionally and have had great conversations. But yes, there are other, you know, public health agencies that are making it work. And I think some of the pieces are to be seen. I think it's exciting to think of, because, you know, as you know, in the beginning, learning a new database is, you know, will take time. But I think that overall piece of, hey, where do we shift? I think that's a great question, Sarah. And I think it will alleviate some folks feeling like, oh, I can actually breathe in the day instead of, you know, putting 11 plus hours in and realizing that you haven't eaten or done anything other than, you know, work. Not that that's necessarily horrible, but at the same time, it's not a, you know, maintaining pace, as we all know. So I think it would be exciting to see some of those, where those efficiencies come in, and even, you know, seeing how, you know, there's so many pieces, you know, in a lot of our job descriptions in public health that kind of blend into other places where we might have opportunity to be like, hey, we've always wanted to work on X. We finally have the time because, you know, we can free up some time with some other folks. And so some of those pieces are to be seen, if you will.
Colleen, what kind of implementation assistance would Patagonia Health be able to kind of come in and do? I'm a little bit worried about the implementation and transition into a new system while we kind of continue to be under capacity for responding to, you know, other things. I wouldn't, I get that the intention is to simplify things, but I just want to avoid that unintended consequence of actually exacerbating the issues.
I get it. So this is a fully cloud-based system. They provide 100% of the support that is part of your subscription. So there wouldn't be anything that AMIT would need, because most of this, like I said, is going to the state database. It would be held in the cloud. And so it wouldn't interfere with anything that's happening on, you know, the county servers, if that makes sense. And I think, you know, they talk about like the training and everything else. They have the ability to do it virtual. You know, and I think too, you know, this is for, you know, nurses specific, and then we'll work with some of our support staff. And so, you know, all of us have worked with an electronic health record in, you know, other positions that we've held, you know, both in the county and out of the county, and, you know, even, you know, that you're trained on, right? Because this is the standard, right, is to have an electronic health record. So I think the uptake isn't going to be, you know, super cumbersome. I think what I get excited to is the scheduling system, which is something that we struggled with on our Outlook, if you will, in the sense of how to separate, you know, people's personal calendars with an actual calendaring system for appointments. And I think this will streamline that dramatically. Instead of like, oh, I put it on my personal calendar, now I have to put it on, you know, a blood-led immunization calendar and or a family planning calendar, or hey, we forgot to slide that appointment to this calendar. I think it'll clear up some of those headaches that we kind of deal with on a daily basis, because we're kind of using nothing but trying to make Outlook work in a scheduling world with us. And Amit is well aware of all these things. And I think you fully support the scheduling software that comes with this. But like I said, it doesn't impact our county servers. It's all cloud-based, HIPAA compliant. And I did share, you know, the full contract that kind of spells out all of the training pieces and what's the requirement. But, you know, we can scroll through them if we feel that that's appropriate and or revisit as needed.
So would all the information, would they work primarily with the state to import all the existing information? Because the state already has, in theory, all of your information? This
Right,
wouldn't,
so it wouldn't be a matter of importing the state, we have to, we chart by hand and then we enter into the state database. Now we would just have to chart in this electronic health record and it automatically gets uploaded into the state database. The piece that I think maybe is the question is, we have charts specifically around family planning that go back, quite a while, and that isn't something that they do, right? It's not like they bring someone in and, hey, let's scan in, all of these charts and upload them into people's charts. We would do that as we go. Like, hey, client comes in, we'd open up their paper chart, we'd scan it and upload it right away as an efficiency piece. Because I think of that, like when you think of like building and land use and, even what we have for environmental health here of, hey, it would be so great if everything could live in one place where, you bring someone in to upload all of those past documents into a system. We feel confident that we can do that, as people come through our doors, and we're only required to hold records for, 7 years. And so we feel confident that, we can make that work as people come through our doors.
Okay. Commissioner Glenn, do you have any questions for Colleen at this point?
No, I don't.
Okay. Colleen, I am wondering if it would be okay if we would have legal look through this agreement before we take a vote on it, just to make sure that it's Tabor compliant and that type of thing.
Yeah, no, absolutely. I think it's something I've been trying to bring your attention to, and I figured I'd throw it on the agenda so that I have everyone here and we can talk it through. And I think, that is important, like for public health, like this is where I feel strongly I want to allocate CARES funding that was set aside for public health. And if it's only, 60,000 versus 100, that's totally, doable in the sense of just reworking the following years. I would hate to lose out on an opportunity for something that will not only help us in the short term, but will actually help us, in the long term moving forward.
Okay, awesome. Thanks, Colleen. So we will give this to legal and put it on our agenda for our meeting 2 weeks from now, if that's appropriate.
sounds good.
All right.
By that
Commissioner
time, we'll
Glenn?
know a lot.
Oh, go ahead, Sarah.
No, I was just gonna say we'll know a lot more about some of the other pieces as well, and maybe be able to wrap up the full, a lot of the budget.
Awesome. Thanks so much. Commissioner Glenn, does that sound appropriate to you?
Yeah, that's fine.
Okay, thank you. All right.
Thanks, guys.
Yeah, thanks, Colleen. We appreciate your time today. So number 4 is the agreement for, let's see here, the agreement for services between the Board of County Commissioners and Left Hand Management LLC. This is with Janine McGee. So Janine is on the phone with us, and if she would like to walk us through.
Yes, so this is part of a grant that we received from the Department of Healthcare Policy and Financing, otherwise called HCPF. And we did an RFP for the project, and this was the contractor who received the contract. And the grant is to do enrollment with behavioral health and medical providers who are not already enrolled with Medicaid, to help them through that process. This is in approximately 10 counties, many of them rural, and it's an effort of the Colorado Human Services Directors Association, and then Lake signed on to be the grant manager and fiscal manager. So I'm filling that role, and this is the actual contract for the work that is done by Left Hand Management, who specializes in assisting with providers with enrollment. It's a highly specialized process, I guess, where it takes months to get approved, to turn in all the right documentation, and then once you're approved, to make sure that you're billing correctly so that you are getting reimbursed. So this effort will happen in about 10 different counties with providers who are not yet Medicaid enrolled. And since we are technically the grant manager, fiscal manager, we are in charge of the contract. Any questions? Just to
I don't
also
have any.
note, Left Hand Management did this work in the past 2 years for the same project in other counties. Go ahead.
Okay. I don't think I have any questions. This just went out through the RFP project and they responded, correct?
Correct.
Okay, great. I don't have any questions at this point. Commissioner Glenn or Commissioner Mudge, do you have any questions for Janine on this agreement for
No.
Medicaid?
No, thank you.
No, I don't.
Okay. All right, I will entertain a motion.
So moved.
Okay, so we have a motion on the floor to approve
Well, to
the
do
agreement.
what?
Well, to we make a motion to approve the agreement for services between the Board of County Commissioners and Left Hand Management LLC. Commissioner Glenn, is that the motion you wish to move?
That's what's on the agenda.
All right, thank you very much. So we have a motion and a second. Commissioner Mudge, do you have any further discussion?
Nope, thanks.
Commissioner Glenn, do you have any further discussion?
I do not.
All right, seeing none, all those in favor? Aye.
Aye.
All right, thank you very much. Thanks, Janine, we appreciate it.
Sure, thank you.
All right, so number 5, Mineral Belt Trail grooming, and I will hand it over to Amber McGee to walk us through the bids that she's received for the Mineral Belt Trail. Okay,
Sorry, can you hear me?
I can.
Okay, so this is the only bid that we've received for grooming this winter. It is from Mountain State Snowcats. They have been our groomer for the past 3 years. We did reach out to the Lake County High Rider Snowmobile Association. They were not in a place where they felt like they could submit a bid this year. So the total, the way we break this bid down is by mile for the Mineral Belt Trail. So it's $38.90 per mile. That includes operator, fuel, maintenance, and travel for them. And then they groom at Dutch Henry as well when CMC is on their break. So that is by occurrence, and it's $189.25. Again, includes operator, fuel, maintenance, and travel for their staff. And so I would recommend to you as a board that you also award this bid in this meeting, unless you would like to do that in a special meeting on Thursday.
Thanks, Amber. This is the only bid that you had received for the grooming, correct?
That is correct.
And did it change any from they did it for us last year, right?
Yes, they have now done this this will be their 3rd season with us if you award the bid. The price has increased by $2 per mile for the Mineral Belt Trail, and actually it might only be $1. Hold on, and I can look. I think it increased $2 per occurrence for the Tubing Hill, and then let me check the cost on.
While Amber's looking that up, I know, I had gone to the Rec Advisory Board annual meeting, and there was a conversation about grooming and kind of getting the counties, in the past when this idea was introduced, it was kind of fix the groomer that we have and staff it with who, because volunteers we're running into issues and problems with consistency of volunteers being able to get out there and or being trained and being safe on the equipment, both for themselves, of course, and for the maintenance and repair of the equipment as well as the trail. We had some issues in a couple of snowstorms, and so I think that the work of Mountain State Snowcat has been great. We've been under budget, whether or not that's, I think we've budgeted conservatively, and that one year had budgeted 28,000. And correct me if I'm wrong, Amber, I think last year we spent 18 based on the occurrence that they groomed for us, and knowing that, we will be relying on all kind of attractions and facilities that we can to keep people coming up safely through with the winter season with COVID. I don't know that anybody can argue that the Mineral Belt remains a pretty valuable asset to the community. All that to say, it'd be nice if we could, establish some consistency in budgeting for that year after year. And I think the Rec Advisory Board would appreciate a conversation with the Board of Commissioners to figure out what that formula might be moving forward.
So my apologies, I had the numbers incorrect. So the increase to groom the tubing hill was a $6 increase per occurrence. And then the increase on the Mineral Belt Trail is $1.10 per mile. And then, yeah, I will just say that while I do think you should award this contract, we do need to have a follow-up budget meeting for recreation, because I do not have money budgeted for this year. So we don't currently have a plan in place for how we're going to pay for this.
All right. Commissioner Glenn or Commissioner Mudge, do you have any questions or comments about the grooming bid that we'd received?
I don't have any questions about the grooming bid in particular, and just want to say again that I think that if we vote to approve it, we of course include that operational budget in the rec department's budget, and move forward with that conversation of what that looks like in years to come. And I also am curious for our next process going out to bid, if we look at bidding this over a number of years, might we find some cost savings in a longer agreement? But that's for future conversations.
Thanks. Commissioner Glenn, do you have any questions or comments for Amber?
I do not.
All right. Thank you very much, Amber. I will make a motion that we approve and accept the bid for the Mineral Belt grooming with Mountain States Snowcat.
Second.
All right, thank you. Commissioner Glenn, do you have any further discussion on the motion on the floor?
I do not.
Commissioner Mudge?
No, thank you.
All right. Seeing none, all those in favor? Aye.
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 All right. Thank you very much, Amber. We'll work with legal to get the proper documentation to Mountain States and get that rolling.
Great, thank you.
Thanks, Amber. I appreciate it. Number 6, landmark environmental additional disposal cost for environmental testing. So this cost comes to us with an additional cost to the environmental testing that Landmark is performing on the 2 potential sites. For the Justice Center due diligence, it's an additional cost of $1,800 to dispose of the materials from the testing. And so with that, I'm going to let legal talk through that for us a little bit. Chris, if you'd like to just give us a little more detail.
Sure. In effect, this has to do with Union Pacific's insurance requirements for access on their property in order to do the due diligence that was previously approved by the BOCC. And essentially what it was is there were 2 contractors. Landmark is the environmental contractor, and then YEH is the contractor that was to do the geotechnical due diligence. And essentially, EA does not have the required insurance coverage in order to take care of disposal of the I don't know what to call it, the debris, the borings, the material that comes out of the borings when they're done. And so Landmark is going to step up and take care of handling of those boring materials, because they do have the qualifying insurance for that Union Pacific requires. So in effect, it's just adding that responsibility onto Landmark's contract that was above what they had already contracted to do. And so they're asking for the additional $1,800 to cover the additional borings that EA will be doing for the geotechnical part of it. I hope that makes some sense, but it's essentially just passing on responsibility from EA to Landmark for those borings.
And Chris, I'm sorry, that was for the, just for performing the borings or for the disposal?
Essentially, it's they're adding additional borings, and then originally it was proposed at, I believe, 4 borings, and that's been expanded to 6. And then so to do the additional borings, and then also to dispose of any materials that are created as a result of the borings, especially if they do end up being contaminated.
So can we use the repository as something here, or is this all about the insurance and the liability coverage?
Well, I think it's
That cost.
about the insurance and liability aspect of it, but it's also the additional borings that Landmark will be doing.
Okay,
So it's an expansion. It's not just a matter of
right.
disposal. It's an expansion of the actual services that they're going to be performing.
Okay. Okay.
Thanks, Chris. I don't feel like I have any additional questions on that at this point. Commissioner Glenn, do you have any additional questions or comments at this point?
I do not.
Okay.
I don't have, no, I don't have anything else. I mean, no, I don't have anything else, just to make sure that, you know, if they need to transport and deposit that, I think that we can make accommodations at the repository. I mean, we're really not talking about cubic yards of anything. I don't think so. It'd be pretty insignificant.
Yeah, Commissioner Mudge, I'll make sure that they're aware of that. And just to refresh everybody's recollection on this, so Landmark is actually engaged through Melanie Granberg's firm, Gable House Granberg, to do this work. And so it's essentially going to be a pass-through. But I will make sure that they know that the repository may be available to accept the material from the borings if that factors into the cost. That wasn't my understanding, but I'll make sure that's they're aware of that.
Great, thank you. Well, I'll make a motion to approve the increase of scope of work from the 4 borings to 6 at a cost of $1,800 set out by Landmark.
Second. Commissioner Glenn, do you have any further conversation or discussion of the motion on the floor?
I do not.
Commissioner Mudge?
No, thank you.
All right, seeing none, all those in favor? Aye.
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 All right. Thank you, Chris. We appreciate it. And I would assume that then the next follow-up would be that you would be in touch with us about the logistics of that. Yes.
Essentially, all it is, it's a amendment to the contract that y'all previously authorized Melanie Granberg's firm to enter into for Landmark services. And so I think this was primarily just to make sure that there wasn't any concern with the additional $1,800 in cost coming under that contract. So there shouldn't be anything specific that the BOCC needs to sign.
Okay, sounds good. Thank you very much, Chris. I appreciate it.
Sure.
All right, so with that, we'll move on to our final item on the agenda, which is number 7, the renewal of Safeway Store 46 Incorporated Fermented Malt Liquor License. And I will hand this over to our clerk and recorder, Patty, to walk us through that. So Patty, are there any questions, concerns? Did you receive any comments about this liquor license?
I did not.
Okay.
Everything appears to be in order and the fees have been paid. This is a master file of all the Safeway stores, but they approve them individually as well.
Okay.
Everything appears to be fine.
All right, great. Thank you so much, Patty. We appreciate it.
You're welcome.
All right. And so with that, I will make a motion that we approve the renewal of the Safeway Store 46 Incorporated Fermented Malt Liquor License.
Second.
All right. Commissioner Glenn, do you have any further discussion?
I do not.
Commissioner Mudge?
No, thank you.
All right, seeing none, all those in favor? Aye.
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 All right, thank you both very much. The last thing on our list today is bills and payroll for pay period ending October 23rd, 2020, and I will make a motion that we approve bills and payroll for pay period ending October 23rd, 2020.
Second.
Okay, Commissioner Glenn, do you have any further discussion?
I do not.
All right, Commissioner Mudge?
No, thank you.
All right, seeing none, all those in favor? Aye.
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 All right, awesome. So we will have a work session next Tuesday to talk through some of the remaining CARES Act funding, and then reroute with legal to talk about the electronic health records and put that on our list as well. Seeing as it's almost election day, I'd like to thank our election judges for their time to help put on the election. We definitely appreciate the work that you are doing. And thank you, Patty, for making this work with the COVID pandemic. I'm sure it hasn't been easy.
Absolutely.
Thank you. Thanks for that. And seeing as Commissioner Glenn's term is coming to an end, I'd just like to take an opportunity to thank him for his service to his community. So thank you, Commissioner Glenn.
You are welcome.
All right. So with that, today at 2:14 p.m., we will go ahead and adjourn, and we will see you all shortly. Have a great week.